Hi, hope you're all doing fine. In this video, I'll be giving you the list of important topics in general surgery. So as I have been doing with other subjects, I have compiled a list of important topics based on their frequency of repetition in the latest entrance exams, right? So I advise you to note down the list simultaneously when I'm giving you, right? So starting with the important topics in diseases of salivary and thyroid glands. So we have various topics like cyst trunk operation asked in GSET 2014, FNAC, a question on FNAC, fine needle aspiration cytology asked in Kerala 2015, and the treatment of thyroid storm, right? And also there were questions on cricothyrotomy in Comet 2014 and AIMS 2015. And also questions on occult thyroid malignancies, papillary carcinomas, and also a question in MHSET 2015 from ranula, right? And also a question from lymphatic drainage of thyroid, right? So these are some of the topics from diseases of salivary and thyroid glands. And coming to infections, so we have questions on palpable crepitus in Karnataka 2013, Pasteur's sign or Thompson's sign in scarlet fever asked in MSET 2014, Pott's disease, tuberculosis of spine in AIPG 2014, and a question on gangrene in Kerala 2016, right? And also we have several questions from trauma. So we have a question in AIMS 2013 on mass casualties, and also a question on epidural or extradural hematoma in AIMS 2013, and also various questions on Lymph fractures, Glasgow coma scale, and also on cardiopulmonary resuscitation, CPR, right? Also we have few videos on Lymph fracture, different fracture patterns, and also the treatment aspect of Lymph fractures, and also we made a video on Glasgow coma scale, right? So you can check out those videos for more information. And coming to topics in cleft lip and palate, so we have several questions from these areas. So we have questions on classification of cleft lip and palate, the views classification and Y-shaped classification, different classifications, and there are questions being asked repeatedly from classifications of cleft lip and palate, so you need to focus on that as well. And also questions on clinical features of cleft lip and palate asked in Comet 2014, NEET 2013, and also the theories or mechanism of clefts asked in AIMS 2014, and etiology of cleft lip and palate, or inadequate fusion of what processes leads to cleft lip and palate, even that's very important. And ideal time for repair of cleft asked in AIPG 2015, and various cleft palate repair techniques asked in AIPG 2014, right? And coming to swellings, ulcers, and tumors of head and neck, so we have several questions on the clinical features of keloid asked in Karnataka 2013, and also a question on tumor antigen S100 asked in GSET 2014, and several questions on types of wounds, stab wound, incision wound. So we had different types of wounds, right? So, and also a question on empyema asked in GSET 2014, and a question on axillary lymph nodes asked in AIPG 2015. So we have three levels of axillary lymph nodes, right? So we have questions on them as well. And coming to diseases of pharynx and larynx, we have questions on quinsy. In fact, a diagram based question was asked on quinsy in APPG 2015, and a question on Zork flap in tracheostomy. To spell it, it's B-Z-O-R-K, Zork flap, asked in MHPG set 2016, and complications of airway management asked in MHPG set 2016, right? And coming to another topic, transfusion, shock, burns, and wound healing. So we have questions on various signs of shock. In fact, the question is, what is the first sign of shock, right? It's tachycardia. So it was asked in APPC 2015, and treatment of severe burn injuries asked in Karnataka 2013, and also a question on jugular venous pressure. So we made one video on jugular venous pulse. You can check out that for more information. And causes of shock asked in PGI 2013. So we discussed in detail in one of our videos regarding different mechanisms behind shock, the classification of shock, and also the treatment plan. And also we have questions on the features of anaphylactic shock asked in Comet 2015, and a question on plasma expanders for treatment of shock asked in MHSET 2015. And also we have questions on various acute and delayed blood transfusion reactions, right, asked in AIMS 2014. And we have one question on management of varicose veins. So pertaining to topic arterial and venous disorders, we have question on varicose veins, right? So asked in Karnataka 2013. And coming to various miscellaneous topics, we have questions from fiber optic aided intubation asked in NEET 2013, and also a question on IVRA, intravenous regional anesthesia, asked in again NEET 2013. And also we have question on DMV, difficult mask ventilation, asked in AIMS 2013, and a question on management of tension pneumothorax, and also a question from the topic discharge criteria following sedation, asked in COMET 2016. And finally, we have one question from various immunosuppressive agents used in organ transplantation, asked in GSET 2014, right? So these are some of the important topics which you can focus on while you're preparing for general surgery, right? Hope it's clear.